Mode.
Good morning, everyone. It is Thursday, October 3rd. This is Deb Wilkinson, of course, of URL Insurance Group. I'm sure everyone is having a great time this week since the opening of the federally facilitated marketplaces. I know that it's been just a barrel of monkeys here with everything coming in piecemeal. But once again, I thank you so much for taking time out of your what I know to be very busy days to listen in and ask your questions. Again, when you're asking questions, we all learn from each other. And if I don't know the answer, I will certainly make sure that I get that answer to you. Hopefully everyone can hear me. If you could just raise your hand in the little box to the right of your screen and let me know, I'd appreciate it. Let's see if I see okay, I see some hands. Thank you very much. And as we proceed through the PowerPoint or the program, if you have questions towards the end when we have our open forum, you can raise your hand and I'll unmute you as they come in. And you can, of course, type the questions that you have into your question box also down towards the end of your screen to the box on the right of your screen, if that makes any sense. First things first, I wanted to let everyone know that, give me one second, that we are getting some product information in. It is coming in piecemeal, but as it comes in, Sarah Ortega is going to be updating our website. Both Jim McDaniel, our Director of Marketing and Advertising, and Sarah have worked very hard on revamping our website to make it a little bit more user-friendly to our agent partners. But I think what you'll find, too, is that hopefully it's easy for you to navigate, bad choice of words, I'm sure, but easy to navigate and find the plan information. And as it comes in, again, it's being uploaded to our site, which is urlinsgroup.com, and you would just go under the health plan options section and then under product information, and then you would choose the appropriate carrier. What you're going to see is, and again, these are in the process of being uploaded, but you're going to see private marketplace information and public marketplace information. Right now, you'll see some rates and some comparisons on the product information as well as the current product information that is going to be able to be sold up until, in this case for Capital, up until 12/15 effective dates of 2013. All the forms, everything that you need. So just keep going to the website because I think that that's at least a hub where you can find the most pertinent information that you're going to need. And of course, we're always here to help. Myself and my case managers, both on the group and the individual side, are certainly able and willing to help you in any way. So just give us a call. So enough of the short commercial. We're going to start the presentation, and a good place to start is with the updates on any of the portal issues that you all have been experiencing. Surprisingly, the Marketplace Learning Network site in which you take your certification, that seems to be running smoothly. I'm going to knock on wood because I've not had too many complaints about that. The only issues that we have had is going back in and grabbing those certificates of completion from your curriculum. I don't know what the issues are, but I can tell you that once again, URL is here to help you. David Dang in our Internet Technology Department is very willing to help get those certificates, and if you just let me know that you're having difficulty, I can get you in touch with David, and he will just ask for your username and password to your Marketplace Learning Network. He'll go in, pull all those certificates, and email those to you. So hopefully you'll take advantage of that if you're having difficulty. The second step in the process after you're done with your curriculum, of course, is registering on the portal.cms.gov site. Now, I can tell you that people have registered, and then when they go back in, they're having issues that the system is saying they don't recognize you if they're able to get in. And that, again, is a systems issue. I'm not sure when it will be corrected, but just hold the course. Just keep trying because, quite frankly, you know, there's really no deadline to getting that done. So the only thing I can tell you is, you know, another systems issue from a government website. Surprise, surprise. But just keep trying. And of course, any of us that have tried to get into healthcare.gov to actually do some quoting or see what all the you know, the talk was about, I don't know anybody that actually has gotten in. There were systems issues, obviously, even trying to get in. When you get in and you want to look at quotes, you actually have to create an account, answer some security questions, which was a glitch in the system, and then essentially, on behalf of your clients, enter all of their information down to their income in order to even view the plan designs and the pricing. So we've not been able to get the whole way through the system yet. So if you have, congratulations. If not, you're definitely in the majority. And you know, again, as soon as we can get access to all of this information, we're going to get that out to you. In the meantime, some of the carriers actually have ways to quote on the federally facilitated marketplace and outside. So we'll, you know, again, just contact your case managers or myself, and we'll help you through the process. Many of you have asked about our online quoting portal and when the 1/1 plans will be updated. I'm getting that to our partner, EBIX, as quickly as they are coming in, and they are working diligently to get those 1/1 plans loaded. What you're going to see on that quoting portal is the private quoting information, the private exchange, off-exchange products and pricing. As many of you know that have joined us weekly, URL has also filed for a web broker status, and we're proceeding with that, but we really don't have a whole lot of new information to share other than we're probably about halfway to 3/4 of the way through that process. And once that's done, we will have a fully functioning, hopefully side-by-side quoting portal that you can compare on exchange, off exchange, and furthermore make application either place. So we're excited about that, but you know, we don't have a lot of more information to share on that. So I've been getting a lot of questions about the certification to sell within the federally facilitated marketplace, and it's not too late to certify. You will be able to get through the curriculum in a day's time, and then through the portal.cms.gov registration. So, I mean, you're looking at about a week's worth of testing and then registering on the site. But, you know, it's not too late. You just have to be certified to sell within the federally facilitated marketplace prior to submitting any application. And for 1/1 effective dates, you can submit applications up to 12/15. So again, there's plenty of time. I would, you know, not sit on it too much longer, but you can still certify. And if you have questions on that, let me know. Another question, and we're getting all this information in, is what do you do with your marketplace certification certificates of completion once the curriculums are completed? And different carriers are requiring different things. All of this information, some of it was in my last week's Healthcare Reform Essentials newsletter. It's going to be resent and in addition include any of the new updates that we received on what you need to do with those certificates of completion. It will be in, I'm not sending out a newsletter today, it will be tomorrow because I want to give up to the last minute to be able to get everything I can in there that's coming in this week. And as you can imagine, it's pretty rapid fire. I can tell you for your certifications, and many of you have sent me the certificates, and I'm not going to be able to do anything with them. But Capital Blue Cross is asking for an email of those certificates. Highmark, you actually, for both Central and Western, you have to go in and register on Sales Sentinel and upload those certificates. So they have a process different from most. Blue Cross of Northeastern PA is asking for an email. Health America, email or fax. Geisinger, we don't know yet. Aetna, we don't know yet. And Independence Blue Cross, you know, again, they're going through Sales Sentinel. So, again, that information will be in my newsletter, which will be coming out tomorrow. A little bit of an update on products. Again, everything's piecemeal, but what we have received so far is some UPMC information on products, Cap Blue Cross, Highmark Central and Western. Geisinger, we have a plan grid. The rates are only available if you go to Geisinger, the GeisingerExchange.com, but they're working on paper rates. We have nothing from Aetna, and we're told that probably we wouldn't get anything till next week at best. Blue Cross of Northeastern PA, same thing. Health America One just released their information for both Pennsylvania and Ohio, and I'm still waiting on Independence Blue Cross. You know, talking about Health America One, that brings up some questions that many are asking. I did send a letter to all of our agent partners that are licensed with us with Health America One, and as of for any sale of Health America One product with a 1/1 effective date and beyond, URL is not going to be functioning as a general agency. You will receive information directly from Health America on what you need to do if you want to continue to sell those products. But, you know, again, Health America was acquired by Aetna, so they have, you know, they have 2014 essentially as a Health America One product, and then more than likely in 2015, what you're going to see is those products and the name themselves be absorbed into the Aetna family of products. All of the general agencies, actually the 4 general agencies that were left with Health America One were all terminated, and it had nothing to do with sales results. It had everything to do with their plan going forward because of the acquisition. It has no effect on URL's general agency status as a Health America Group wholesaler, and we are still and will function as a GA for Health America Group, and it has absolutely no effect on the Coventry Medicare Advantage programs. We are still the #1 general agency for the Coventry Medicare Advantage product. So it's very specific to Health America One and the way that they are choosing to do business in 2014. So at this point, I know that you have a lot of questions. I have a few questions that I received that I think are pretty commonplace, so I will let you know, just kind of go through those quickly, and then we'll open it up to all of your questions. And there have been a lot of CMS has issued a blast that basically says when you go in to do your marketplace learning, that if you are an agency, you also have to do your marketplace learning under your agency national producer number. And pardon me, we're still quite frankly trying to get clarification on that, because the system itself does not allow, you know, for instance, Ken Clemens is our president and CEO. URL also has a national producer number. We are not able to go in and register URL under their national producer number because a single email address cannot be used for more than one account. So we're still waiting for clarification on that. And I have messages into the carriers to see if that's even valid, because Medicare Advantage, a CMS product line, does not require that, only that the active officer is appointed and tested and certified. So my suspicion is that the active officer would probably need to do the testing, but as far as creating another account for the agency under that active officer, you know, that the jury's still out on that. So as I get information on that, I will certainly pass that on. And another question is, will Health America One, Highmark, and Capital notify the broker of their book of business and renewal notices with alternate ACA plans, like Aetna is going to? And the answer is yes and no. Health America One is asking for an early renewal, well, the early rewrite. So if your clients choose to have an early renewal, they will actually have to submit a new application and go through medical underwriting. My suggestion is, if they're going to go through medical underwriting, you know, look at other options as well, if you want to do that. Highmark, any plan on the books currently, except for the guaranteed issue programs, can stay in place until 12/31 of 2014. And Capital Blue Cross, same thing. If any plan is on the books now, those plans can stay on the books until November 30th of 2014. So, pardon me. Again, I have some information on what each carrier is doing, and I'll be getting that out actually next week. But if you have specific questions, again, call, email, either myself or your case managers, Judy Reed at judyr@urlinsgroup.com, or Jessica Kyer, Jessica K at urlinsgroup.com. So those are some of the questions that I've received. I'm going to open it up now to all of your questions, and I'm sure each of you have some. So by a show of hands, if you want to ask your question out loud, I'm happy to unmute you, and you can go from there. Let me just see. All right. I have some hands coming in and out. So I think what I'll do is I'm going to go to the questions that are typed in, and then we can revisit the questions that maybe somebody wants to answer or ask online. So the first question is from Scott, and he says, what is the best way to confirm with Capital that they received the completion certificates I sent them for my participation with the exchange? Scott, I would say that you may want to email them and verify that. I would love to do that for you, and I will do it for you, Scott, but obviously it's going to be very hard, very hard to confirm with them for each and every one of you. So I'll email them, Scott, but also in the Healthcare Reform Essentials newsletter that's going out tomorrow, you can email them back to the same email and just ask them. Another question is from Dave. The information from the carriers on plans and rates and procedures has been minimal at best. That's an understatement. I feel like Stevie Wonder without the piano to my sub-brokers. Have you been provided with any compensation figures for Highmark, Central and Western, Capital, or UPMC? Frustrating. And I can say, Dave, that no, I have not. It is frustrating for all of us, because that certainly is going to determine for not only your sub-producers, Dave, but all of ours and everyone else, what plans are viable and what your marketing plans might be for 2014. So I can tell you as soon as I get the information, I'm passing it on, but I have nothing at this point to report. And there was a question about an agency registering with the exchange to sell on the exchange, and the question, Dave, is that the active officer should take the testing just like they do on the Medicare Advantage. The question, though, is about whether the agency, too, has to also create an account and do testing under the agency's name. So Hope that answers your question. I would say active officer, yes. Agency, probably not. Another question from Cindy? Any further clarification on certification required for the agency to receive commission? And Cindy, no, I don't have a whole lot other than what I just mentioned. And so does that mean we will do business as of 1/1/14 directly with Health America One? And yes, Scott, that's correct. As of 1/1 effective dates, if you want to pursue appointment and contracting and writing business with Health America One, it will be a direct to Health America One contract, and they're going to be sending information on what you need to do to get that taken care of. And another question about the agency and the certification for the agencies. And Rich, I have nothing at this point. I have messages out to both NAHU and to a prominent Blues carrier, and I've received nothing back yet. And question from Allison, do the marketplace subsidies go by gross or net income? It actually goes by, I have a really good piece that I received from Health Reform Beyond the Basics. It's about premium tax credits and answers to frequently asked questions. That will be in my newsletter, but what they're saying, it is on the expected income for 2014. So that could get pretty tricky since none of us really do know if, what our income is going to be in 14. The penalty for not having insurance goes by your modified adjusted gross income. So there's a couple different things going on there. But again, I'm going to send this piece out, and I think that will answer most of your questions. But of course, if you have very specific questions, give me a call. There's information on how you get certified. I'll include that information also in my newsletter, and there's also a comprehensive PowerPoint that kind of walks you through the steps. So Ken, that will go out tomorrow, and I'll make myself a note so I can send that to you, that information to you directly. So I'll get that out to you, Ken. And there's a question from Mark. Will in and out network exist under new system? I think what you're asking is, will there be a viable market inside the exchange and outside? And the answer to that is yes. Some carriers are offering different products inside the exchange than outside. All products as of 1/1 have to be PPACA compliant and meet the metal levels of coverage, but you're going to see some different plans in and out with some carriers, and you're going to see different same plans in and out from other carriers. But if you're certified and licensed with that particular carrier, then you're going to be able to sell whether it's inside or out. So I hope that helps. There's a message from Justin saying that he is a new health insurance agent, and he's been licensed with some of the carriers, and he wants to know if he has to be licensed or certified to sell in the marketplace, and the answer to that is yes. If you don't want to sell within the marketplace, just your simple contracting is all that's needed with the carriers, but the certification to sell within the marketplace is required if you want to take part in those sales. And Justin, I will send you that information as well. So I just made myself a note. There's a question from Margie. She assigns commissions. Can I do the certification for my principal, agent, or agency? Well, Margie, you didn't hear from me, and yes, this call is being recorded, but I would say yes, that you can assist in that if you would like. Since payment will be required by 12/15 for a 1/1 effective date, are the carriers, this is from Tracy, are the carriers going to accept online payments from clients? We should make clients aware that a payment is required for those who wait to enroll until mid-December. And Tracy, I would agree with that. And yes, online credit card information is one of the payment methodologies that an insured can choose. And yeah, I would say that that's very good to make them aware of that information, because they can make application by 12/15, but those plans cannot be activated by a carrier until payment is received. Brett is asking what the commissions in the exchange will be, and that's, you know, the million-dollar question, Brett. We've not received any information other than the Health America One information that went out, which equates to about $18.75 per application. It's paid in a lump sum 30 days after the policy is activated at $225. If the policy is not in force for a full 4 months, then it is 100% chargeback. So that's the only one we have information on at this point. The commissions in the exchange and outside the exchange will be the same. So once we know what they are, we'll let you know. And is the penalty if you do not purchase an ACA plan by 1/1/14 or 3/31/14 this year? That's a really good question, Margie, because on the news all you hear now is that they have till 3/31. Well, if a person does not have qualified coverage for the year of 2014 with no less than a 3-month non-coverage period, then they will be assessed a tax, a penalty, a tax. If a person waits until 3/31, the earliest effective date that they can have is 5/1. So essentially, they're going to be 5 months, well, 4 full months without coverage. So they would be subject to a penalty if they waited that long and did not have compliant coverage, if they're uninsured. If they have coverage that is grandfathered, rolling out or running out through 2014, then there won't be a penalty because it's under the safe harbor. Hope that makes sense. And another question from Tracy. I have a client who applied for Marketplace and was told she was eligible for subsidy, but because her state did not accept the Medicaid expansion, they would not receive a subsidy. Do we know if this is just for those between 100 and 138% of the federal poverty level? Tracy, that's correct. If the state has not elected to expand Medicaid, then the people that are between 100 and 138% of the federal poverty level are not eligible for Medicaid because they've not expanded it in their state, and they're not eligible for an advanced tax credit because by law it doesn't apply to them. So they're in a catch-22. And Jesse asks the question, do you have hard copy of the product rates for 2014? Jesse, we have some. We don't have others. Highmark does have their rates in paper format, and again, they are on our website now, and they're going to be in the newsletter that comes out tomorrow. And there's a question from Nate. Did you get my question about spouses and subsidy if other spouse has access to group coverage? Nate, I didn't get that question, but I can tell you that if you're I'm having a hard time saying it because it applies differently. For a group that's 2 to 50, if an employer offers coverage to his or her employees, they don't have to offer to spouses or dependents. If that spouse is not offered coverage, then that spouse can go to the exchange, the individual exchange, and get any subsidy eligible for them based on their household income. and their percentage of the poverty level. If also that employer of 2 to 50 offers coverage, but it's deemed unaffordable for the employee, meaning that that employee is being charged more than 9.5% of the single-only premium, then it's deemed unaffordable, and they all can go to the exchange and get a subsidy. Also, and I know it gets confusing, but also if the employee's portion of the dependent's premium is more than 8% of their household income, then it's also deemed unaffordable, and they can go and get an individual plan and subsidy. On the 50-plus market, dependents' children must be offered coverage. The affordability factors still apply, but if this, again, a lot of employers in the 50-plus market are dropping coverage for spouses so that they can actually go to the exchange and get the subsidy. So I know it's very confusing, and Nate, I'll email you some information just because I know it's so confusing. And, I just want to do a shout out here to Gary, because he's quite the comedian if you would see some of these questions. So very funny, Gary. It lightens up the day. Question from Mark. Under current system, patients go to an in-network doc and pay less versus out-of-network. Will the new system be similar, or will different plans, different carriers have different networks? And that's a really good question, Mark, because, yeah, I mean, that's very true in today's market, where if you go to a network provider, you don't get the balanced billing passed on to you. If you go out of network, then you do. You're subject to usual and customary. Some carriers in the exchange and even outside are going to have limited network programs so that they can drive business to specific networks, not only by doctors in the network, but also in areas in which you live, different products will be available. So I know it's very confusing without the product information in front of any of us for the most part, but the answer is yes. There will be limited network. There will be tiered network, tiered coverage by carriers. If you go to a doctor in this exclusive tier, you get one level of coverage. If you go to the other tiered provider, you get a different reimbursement for your rate. So it's going to get confusing, but yes, that's going to happen both in and out of the network. And members can select an on-exchange plan up to $331.14 with no penalty. And Margie, that's true, but again, it has to be based on if they have insurance now and the amount of months that they've been uninsured. They're eligible to apply, but that individual mandate with the tax assessed on people that don't have coverage, there's a 3-month window. So if they wait till 3/31, they can only get 5/1 coverage, so they would be uninsured for 4 months. So they would have at least 1 month's worth of penalty. Important. It is my understanding, Scott says, that SHOP has been delayed until November 1st. Is this correct? And that's absolutely correct, Scott. The SHOP exchange has been delayed. However, only the IT systems have been delayed. The SHOP programs for your small groups, your 2 to 50 groups, still can make application. The difference is that they can only make application on paper, not through the FFM. We have SHOP rates for 1/1, and we can help you with that. But it will be a submission of paper, not a submission online, which, quite frankly, is comforting to me. Sean asks the question, if a client is below 100% of the FPL, should that client go to Medicaid? Could you clarify the lower threshold of the federal poverty level between 100 and 133%? Yes. If they're at 100% or below, then they're Medicaid. The Pennsylvania governor has proposed an expansion of Medicaid to take care of up to 133/138 of the FPL. But if that is not approved by the Obama administration, then the 100 to 133% are not eligible for Medicaid benefits because the governor has not expanded Medicaid for those adults, and they are not eligible for a premium subsidy either, the advanced tax credit. So I hope that makes sense. Let's see here. From Elizabeth, is there any way for a broker to see the same screen being viewed by their client as they apply, or have the client on the phone and go through the online process for them? Elizabeth, the only way to do this at this time is with a screen sharing application or screen sharing program on your computer. We're using a screen sharing system now called GoToMeeting, but there are free systems out there. Joinme.com is one of them. And honestly, I think that's an excellent idea to have that access, because you can share the screen. You can help them complete the questions while they're watching you in the driver's seat, or you can hand over the screen and the driver's the control to them as well, and you can watch them without ever leaving your house. So I think that's a great option. And another question from Margie: do you apply for each spouse separately, or as a family on the exchange? You would, I mean, you can, it's the same as today's rules. You can apply as a family, or you can apply as a single. So that really depends on the coverage that each person wants. I hope I answered that question, what I thought you were asking anyway. And can we see Highmark plan designs for 2014? You absolutely can, Margie. They are, they're going to be in tomorrow's healthcare reform newsletter that goes out, and they are currently available on our site. And will I be, Alex asks the question, will you be sharing what you discover and answering everyone's questions? Yes, I will. And let me see here. There's a question from Alex asking if there's a certain or special place where we can be meeting people who are interested in I guess, making application. And I mean, there's a number of ways to do that, Alex. You can, you know, I have the Lead Force system up where you can choose specific mailers and specific incomes to mail to, and they can call you, and you can help them make application. You can hold, you know, webinars or seminars for people in your community. So there's a number of ways to do it. Jim asks the question: can an individual credit to an agent in the can an individual give credit to an agent in the marketplace if the individual proceeds on his own in the marketplace, and assume the agent verbally helped initially by word of mouth? And Jim, absolutely. You can go in and you can start the application for them if you choose, or if they have your national producer number, they should be able to get you credit for that sale. And a question from Alex: how will anyone know that I can assist in determining eligibility and in securing insurance through the marketplace? Advertising. Yeah, and that's it. I mean, Alex, I know you are certified to sell within the marketplace, and you know, it can be as simple as letting people know that you are certified to sell Obamacare, or you're certified to help them look at premium subsidies. There's a lot of ways you can do it. And Tracy asks the question: where are each carrier on child-only plans? Highmark will, Health America will not. How will this show on the MP as they choose plans, marketplace as they choose plans? And quite frankly, I don't know the answer to that, Tracy. I know that each carrier has to accept everyone, and if those children are not CHIP eligible, then you know, in theory, they should be able to make application and be accepted by a carrier. But, you know, that one, I just don't know the answer to that fully, and I will find that out for you. I do believe that the stand that carriers took prior to 1/1 effective dates for 2014 will change. And would we go to cms.gov to apply on exchange plans? And yes, that's where you're supposed to go, and not sure if it's even working because it hasn't been the last several days. So those are all the questions that I have on the question bar. Let me just see if I have any other questions with any hands held up. I do have a couple, and I'm going to start with Julia right now. Julia, can you hear me? Well, not sure if you can hear me, Julia. Maybe your question was already answered. And let me see.
Hey, Deb.
Hey, yeah.
This is Jim. Most of the people, I'm guessing, that are on that have a microphone next to their name are on a computer. They may not have a microphone, so you may have some trouble hearing them.
I understand. Okay. All right. Well, it looks like that is it for the questions, as well as the verbal questions. And you know, once again, I really appreciate your time today. We're here for you. You know, we're gonna, as I always say, we're gonna sink or swim together. Your success is certainly my success, so it's important to me that you are successful. And anything I can do to help you through this, I am willing to do. You know, again, all this information is coming in drips and drabs, and I'm getting it out as quickly as possible. But if you have any questions at all, you can contact Jesse or Judy on the individual side, John or Elise on the group side, and of course, you know, you can always contact me as well. We're happy to help. The next webinar is next Thursday, October 10th. However, I have an engagement in the morning, so I'm pushing the time back, and instead of 9:30, I'm pushing it back to 2 o'clock in the afternoon. And that registration link will be also included in tomorrow's Healthcare Reform Essentials newsletter. So once again, I appreciate all your time, and I hope all of you have a great day and hopefully get out to enjoy the beautiful weather we're having. Enjoy your day. Bye-bye.